Hi, I am so elated to meet you in the program of 3 p.m. 3-point medics. So far we have been learning about hyponatremia. So we have discussed about what is hyponatremia and what are the symptoms of hyponatremia and what are the causes of hyponatremia and so on. So we have come to a stage where we have learned the causes of hyponatremia, including the causes, the water excess that dilutes hyponatremia. Then we have observed that there are few investigations that must be done whenever you find hyponatremia. Just I want to recall once again, whenever you find hyponatremia, the first investigation that has to be ordered is serum osmolality. When you have hyponatremia, we always expect decreased serum osmolality. Once serum osmolality is decreased anything less than 275, that means we are dealing with true hyponatremia. So we have ruled out the causes of false hyponatremia, including hyperlipidemia, hyperglycemia, hypertriglyceridemia, mannitol and glycine administration and so on. Once we are very sure that we are dealing with true hyponatremia, the next investigation would be urine osmolality, which we consider a game changer. When we do urine osmolality, our mind should think always whether it is less than 100 or more than 100. If it is less than 100, only 3 to 4 causes are there, namely psychogenic polydipsia, or otherwise called in schizophrenia individual, unintentionally they used to take 18 liters of water which will dilute its sodium. So one psychogenic polydipsia and beer potomania and T-TOS syndrome and inappropriate IV fluid administration, that's 5% X-dose or off normal saline. So these causes we have seen in last session. So once you do urine osmolality, look for less than 100 or more than 100. If it is less than 100, these 4 causes to be thought of. If it is more than 100, then you can simply rule out these 4 causes. If it is more than 100, then headache starts. Then you have 12 causes are there. These 12 causes has to be explored. Then next investigation would be urine spot sodium. As I told you earlier, when you do urine spot sodium, if it is less than 40, that means not much of sodium is excreted in the urine, means kidney is avidly absorbing. So kidney is acting well. So the cause for hyponatremia is other than kidney, namely diarrhea and vomiting from GI tract, GI cause, then peritonitis or burns. These are the causes other than kidney. When you have these causes, then our kidney will try to compensate sodium to counteract the loss arises from other sources. So your urine spot sodium will be less than 40. So these causes, I could say it's a true hypovolemia. Then one more causes are there, that's called false hypokalemia. Even in these cases also, kidney will try to absorb sodium to counteract the causes of false hyponatremia, false hypovolemia. So what are the causes for false hypovolemia? So 3 important causes, namely 2 organ failure, when you have cardiac failure or when you have cirrhosis of liver or nephrotic syndrome. All these causes, they will have enormous edema. Enormous edema means there will be fluid accumulation in the interstitium, but inside the blood vessel or intravascular volume will be very low. But our body will falsely sense that there is volume loss from the blood vessel, something like diarrhea, vomiting, peritonitis. So it falsely signal the kidney in such a way that there is no volume in the intravascular compartment. So what happens? Kidney will absorb sodium. So in these cases also urine spot sodium will be less than 40. So urine spot sodium less than 40 means there is some kind of hypovolemia in the body. So kidney will try to absorb sodium and water to counteract these losses. So what are the causes for hypovolemia? Diarrhea and vomiting and sweating, peritonitis, burns, all these causes where you witness true hypovolemia. But there are few important organ failure which can produce false hypovolemia, because your total body volume is not altered. In fact, it is increased because all of the water will be sequestrated in the interstitial space as edema, but intravascular volume will be less. But whatever it is, the kidney will consider only the intravascular volume as the true volume, whether you have increased total body volume or not. So in that case, all these three situations like cardiac failure, cirrhosis of liver and nephrotic syndrome, so our kidney will try to absorb sodium, so urine spot sodium will be less than 40. So just I want to brief once again, when you find hyponatremia, do serum osmolality. When serum osmolality is less, then you are dealing with true hyponatremia. Once you are assured that you are dealing with true hyponatremia or hypotonic hyponatremia, the next step would be urine osmolality. Urine osmolality will divide 16 causes of hyponatremia into 4 causes as in one group, then 12 causes would be another group. When urine osmolality is less than 100, only 4 causes: psychogenic polydipsia seen in schizophrenia, beer potomania where the people will simply drink beer as is nutrition, and tea toast syndrome where people will take only tea as a food. Then you will have inappropriate fluid administration like 5% dextrose and off-normal saline. All these 4 causes will produce urine osmolality less than 100. If urine osmolality more than 100, then these 4 causes will be ruled out. Then you have remaining 12 causes. Then how these 12 causes will be segregated? Then do urine spot sodium. Then when you do urine spot sodium, if it is less than 40, then causes is not from kidney. So causes from other than kidney, namely causes for hypovolemia, true hypovolemia, and causes of false hypovolemia. Causes of true hypovolemia: diarrhea and vomiting and peritonitis and burns and sweating. Causes for false hypovolemia, then you will have nephrotic syndrome, cardiac failure and cirrhosis. But if urine spot sodium more than 40, then causes would be from kidney. That means sodium is getting lost from the kidney. We will see in the next session what are the causes of renal origin which is responsible for hyponatremia. Thank you.